I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And today I'm bringing you information that could save your life. Not to be dramatic, however, we live in a time and a place where medical error has been declared in the United States as the third leading cause of death. And what do you do if you find yourself in a hospital with a big diagnosis, maybe having had an accident, maybe facing surgery? How do you advocate for yourself? This is a really important question. And because of the nature of our culture, we don't talk about our mortality. We don't talk about what happens when something bad happens. Probably because we don't want to make a self-fulfilling prophecy. We talk about what happens when we have a big diagnosis or a heart attack or somebody finds a tumor. Who does the day-to-day stuff? Who takes care of? What are my wishes? We're going to talk about it a little bit today with Dr. Julie Siemers, registered nurse and a doctor of nursing practice. She is a patient safety consultant and an industry nurse leader and educator. And she wrote a book called How Not to Die in the Hospital. Now, this is a really important set of tools for you, for your loved ones. And I think this is not necessarily specific to menopause, but it's such an important subject that I had to cover it. Please let me introduce my guest, Dr. Julie Siemers, doctor of nurse practitioner, registered nurse, MSN. She's a patient safety consultant, industry nurse leader, and educator. She's also the founder of LifeBeat Solutions and the author of the best-selling book, Surviving Your Hospital Stay, A Nurse Educator's Guide to Staying Safe and Living to Tell About It. Dr. Siemers holds a Doctor of Nursing Practice degree from Touro University, Nevada. She brings more than 4 decades of experience and expertise in nursing practice education and executive leadership to the healthcare arena. She spent 15 years in nursing education, serving in roles ranging from professor to dean, and is executive director at a large nursing university in California. She has a rich background in direct patient care with experience in various roles on the medical surgical care floor, in the intensive care unit, the emergency department, and the trauma resuscitation department at University Medical Center in Las Vegas. Ooh, I bet she's got some stories about that. Additionally, she served as a flight nurse on a trauma helicopter for 10 years. Since 2009, Dr. Julie has been educating students, colleagues, and the broader medical community on the vital skills needed to recognize patient deterioration and ensure safe nursing practices. Now, as a patient safety expert and the founder of LifeBeat Solutions, she is on a mission to make healthcare safer for everyone. You can find out more about her at drjuliesiemers.com. I'll leave the links in the show notes. And please, by all means, share this episode with whoever you think in their life that you know that could benefit from this information. Because as I said, it can make all the difference in the world when you know which questions to ask, you know what things to look for. And Dr. Julie even shared a website that will tell you whether your local hospital is safe or not. Without further ado, here's my interview with Dr. Julie Siemers. Right then, listeners, it's spring. The days are getting longer. And if you're anything like me, you're feeling that little nudge to shake off the winter cobwebs. And just like we might be tackling the clutter at home and washing walls and doing what my grandmother would have called spring cleaning, it's a brilliant time to think about a bit of spring cleaning for our bodies too. Now, hands up, who of you has a whole shelf dedicated to various supplements? Me too. Well, these days, I've simplified things brilliantly with AG1. It's my little daily habit, and honestly, it helps me feel so much more energized as I embrace these brighter mornings. It's just one simple drink to support your digestion, your energy levels, and even our skin from the inside out. And because we're all busy bees, especially as we get out and about more in this lovely spring weather, the AG1 travel packs are an absolute godsend for staying consistent on those weekend getaways or busy work days. Now, when it comes to our health, we want something we can really trust, and that's why I choose AG1. With science-backed ingredients and real benefits I can feel, AG1 makes it easy to support overall wellness every day, and that's why I've been partnering with AG1 for so long. AG1 is offering new subscribers a free $76 gift when you sign up. You'll get a welcome kit, a bottle of D3K2, and 5 free travel packs in your first box. So make sure to check out drinkag1.com/Fiona Lovely to get this offer. That's drinkag1.com/Fiona Lovely to start your spring on a healthier note. I'm delighted to have AG1 as a sponsor of the podcast. Remember, it's a foundational nutrition supplement, and I drink my AG1 every day to support my immune health. It's all part of feeling our best during this fabulous next chapter. Welcome to the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and today I have guest Dr. Julie Siemers with me today. She is an RN and a doctor of nursing practice. Dr. Siemers, welcome to the show.
Thank you. Thank you so much for having me here. Happy to share what I know with your audience today.
Oh, yes, please. There's many things I want to share with you in the course of this conversation, but I think where I want to start the chat is this. You've written a book called How Not to Die in the Hospital. I think you need to tell us about that, please. How did we get here?
Yeah, I'd already been a nurse for 30 years. I went into nursing right out of high school. And when I started researching my master's and then my doctoral degree and chose the topic of patient safety, I didn't really think it was a big topic as it was. And the more I learned, the more I researched, the more I peeled back the layers of the onion. That's when I was like, oh my gosh, why isn't somebody doing something about this? Because it's not new. It's been in the literature for, well, Journal of American Medical Association in 1955 said the most common thing that happens to patients in hospitals is harm. And then 25 years ago, we get the Institute of Medicine putting out To Err is Human and estimating 98,000 people die every year from patient harm. And then the research continues. And in 2013, when we had better access to electronic health records, we could retrospectively go back and look. And these researchers out of Johns Hopkins said, no, it's more like 250,000 to 400,000 patients that die every year. So that began, my journey began back then, but then it just keeps growing. So the book, Surviving Your Hospital Stay, was written to really help educate patients and their families to be empowered, to be educated, and to be informed, because we aren't handling this problem from the healthcare safety end of things. It's not because we don't want to, but we really need to bridge that relationship and that communication between patients and their families and healthcare providers. I know that was a long answer.
No, it was great. There's so many things I want to pick up there. So I watched your TED Talk recently. Thank you very much for making it in such a beautiful, concentrated way, because you can't deny it when you see the details. And there is a slide you put up that says, medical error has been declared as the third leading cause of death in the United States. And that's what we're talking about here.
It's terrifying, isn't it?
It's terrible. So how do we start to learn to advocate for ourselves? How do we get educated about it? Because the thing is, nobody expects to be in the hospital, right?
Right.
So, what do we do when we find ourselves there?
Well, I think understanding this problem really should be the impetus for all of us to become informed and educated. Number one, in our own health, our own blood work, our vital signs, our blood pressure, our health, disease processes, if we've got chronic disease, our medications, really not just counting on the healthcare system to hand out a pill or hand out a prescription, but really take ownership of your own body and understanding it and your family. And that needs really to be a discussion, I think, between patients and their families, especially as some patients get older or we may have some chronic disease. These discussions aren't, around the dinner table, but I think they should be. And that's a great place to begin to say, okay, what do we do here?
Yeah, absolutely. And for this show is about the topic of menopause, and it I'm sure there's some statistic out there that says that many will have their first hospital stay somewhere in this 40s to 50s to 60s era, because our health changes so dramatically at perimenopause. So this information I think is incredibly timely. But what is it that we want to start with? Like you said, I love that you said, let's talk about the vitals. Let's get the chronic diseases, etc. It's, women at this era, we're really learning that we've outsourced our health. Yeah.
Yes.
So when we do that, we turn over the health process to our doctor. But that's just not the way it works. You have to be informed about things. And unfortunately, a lot of women just figure out that they have to be advocates for themselves and be informed because they start to experience things at perimenopause and menopause.
Absolutely. I mean, with the hormone changes and all of those things that really are so vital to how we feel,
Mhm.
whether it's sleep or, all of those aspects of our life that are impacted by menopause, that's a great time to take inventory and say, what is it that I feel? What medications am I taking? What are my blood levels? And what are the alternatives?
Yes, exactly. What are the questions we should be asking if we find ourselves in the hospital?
Well, let's start with one of the chapters in the book, How to Choose Your Hospital and why that's so important. Is that okay if we start
Yeah,
there?
please do. Yes.
There is a website by a nonprofit organization, and the website is hospitalsafetygrade.org. You can go on there and you just put in your zip code, and you can find whether the hospitals in your area are rated A, B, C, D, or F.
Wow.
And this is based on 22 parameters or categories of patient safety. So it broken down into healthcare acquired infections. What's the rate of MRSA at this hospital or C. difficile? How are post-operative patients managed? Do they have a high incidence of preventable blood clots after surgery? Do they have pneumonia post-surgery? And those things are preventable. And so you can look on there and see, gosh, oh, each category is red, yellow, or green. So you can say, wow, this hospital has a lot of red, which therefore they're going to score lower on the grade letter scale, right? D's or F's. But this is so important because even if you live in a small place that does not have a lot of options, become educated on those categories and ask your provider those questions. For example, if you've got to go have surgery and you don't have another option, ask your surgeon, what are you going to do to help me after surgery not get a blood clot? What are you going to do after surgery that is going to prevent me from getting pneumonia? Because I see on the hospital scores, you can have the best surgeon ever, but it's a whole team that really impacts your outcomes after surgery or a hospitalization, right?
Yes. I mean, who thinks about the question you just asked? How are you going to help me not get a blood clot? I mean, this opens up a whole can of worms around we literally just turn it over to the specialist and we don't ask the questions. And I was just interviewing a Sloan Kettering cancer specialist just before I interviewed you, Dr. Shelley Latte Naor. And this was one of the things we talked about was the shame that goes along with having these big diagnoses and how we're not having the conversations about it, or we're keeping that shame inside. And this is essentially part of this conversation, really, is how do we put all the information on the table and ask the correct questions? So interesting.
Yeah, and again, you may not know what the recipe is for preventing blood clots, which thankfully now with AI at our fingertips, we can find out about anything. But that really empowers you to have that conversation with your physician. Say, I know there is evidence-based protocols that can prevent blood clots, for example, since we're talking about that. Are you going to order pneumatic hose for me or sequential compression devices? Had to remember what the SCD stood for.
Yes, yes.
you know, am I going to be able to get up and walk around with early mobility, which also prevents, blood clots? So help me understand the plan, because getting through
Wow.
surgery is one part of it. And then the rest is, healing and recovery.
Wow. Well, and I was saying this, telling you a little bit about the story before we started the recording today, but recently I had a close family member spend time in the hospital. And when he was discharged, he went home and I went to pick up his medications. And as I go to the pharmacy, I have a list in my hand from the hospital. The pharmacy says, we've only received two of these. So where are the others? And then the pharmacist proceeded to spend about an hour with me, going through the different medications, calling the unit at the hospital, calling the pharmacist that was on the unit when he was discharged, et cetera, et cetera. And finally, we got it sorted out. And it was fine because I was sitting there prepared to be the advocate and I knew enough to ask the questions. But as I was sitting there watching the pharmacist do this, I thought, what about our seniors?
Mhm.
What about the people that don't have a support system or that don't have people in their lives that know to ask these questions? So, are there social supports for those parts of the population, and how can we help ourselves if we find ourselves in that situation?
I believe there are probably different locations have different resources, but I can already guarantee not enough. And that is really scary that we have our vulnerable populations that may not have an advocate. I do believe there's advocates you can hire, but again, not everybody has the money to do that. There are also advocates in the hospital. But you bring up a good point with discharge too, because ECRI is a nonprofit organization, ECRI, that puts out a top 10 patient safety concerns every year. Well, it just came out last week, and the top number one concern for patient safety for 2025 is healthcare providers being dismissive or not listening to patients, families, and caregivers. And they call it medical gaslighting. It's not intentional, but it is like biases or misunderstandings contribute to that. But they say that the handoff communication, and that's where discharge instructions come in, are responsible for so much of the patient safety breakdown. And so as we're talking about it, I just thought I would mention it. And it's so important to be there with your family member if you can when they are going home, so that you understand, what do I look for if mom had a hip surgery? What are signs of infection? What are abnormal things that I should watch for and be alert to? I don't know how our seniors are going to be able to do this alone. It's frightening, honestly.
Yes, I absolutely agree with you. In this case, the discharge papers, there was a booklet that went along with it, and it had all kinds of things in it to look for. This is what infection would look like, and this is what, the medication side effects, and this is, when the cardiologist or when the surgeon should call or when the rehab starts, all of these things. And I was grateful to see that because I know that that particular resource has come in incredibly useful. More time, just a silly bit of printed piece of printed paper, right?
Yeah.
The easiest thing.
Well,
And actually, they said there's a video format too, in case we didn't want to read it. which is
Well,
good.
that's good because again, this is a high stress situation and not
Yeah.
you're not going to remember,
Mm-mm.
half of what
No.
they said. So
No,
that's great.
absolutely. Absolutely. And then I really think about the people who have the scary diagnoses, the cancer diagnoses, or the neurological stuff. I mean, do you hear anything that the doctor says beyond the diagnosis? Probably not. There's so many gaps. There's so many gaps,
You're
Julie. How do
right.
we fill them in?
Well, one thing I'll say is make sure if you feel like you need a second opinion, especially for a very big diagnosis like heart disease or cancer, that you get a second opinion. And your physician should not stand in your way or be threatened by that. They should say, hey, feel free, go ask another opinion because I may not know everything. And finding humility in a healthcare provider to me is
Oof.
worth more than gold, right?
Absolutely. Absolutely. Yep.
But the other thing I would say is make sure you get copies of all your lab results, your diagnostic results. Don't wait for someone to call you and say, "Hey, it's normal or not normal." If you don't hear anything, don't assume that it
Oh,
is
yeah.
normal.
Yeah.
You've got to, and luckily we live in an age where we can have those things at our fingertips, get our lab results,
Yes. Yes, absolutely.
biopsy results, all those things.
Yeah, yeah. I always, when patients come in the office and say to me, "Oh, my doctor said it was normal," I was like, "Mm-mm, no, no. We need to actually see the paperwork there. We need to actually see what's going on. We need to look that up right now." And there's a little bit of interpretation there. What's depends on what we're talking about, of course. But also, what's nice is not that I'm encouraging Dr. Google in this moment, but when you're educating yourself about what's going on, throw the diagnosis into AI and see what comes back and start to educate yourself this way. Do you think that's a terrible idea?
It is a wonderful idea. In fact, I
Right.
was listening to a webinar a couple nights ago by the ECRI Foundation and a patient advocate for over 30 years because of what happened to her family. I put her story in my book, but she had another incident that happened to her this summer where she had jaw pain, ear pain, tooth pain, and it was really excruciating for several days. And then her husband said, "Hey, honey, your face is drooping," which she hadn't noticed
Oh,
before. So they went to the emergency room. The ER
trigeminal
doctor ruled out
Yeah.
stroke, ruled out
Right.
brain tumor, and said, I think it's just stress. You need to treat this with benign neglect. And she said, "What did you say?"
Is
So
that
they
he?
went home.
That's not the words
Yes,
he used. Go on.
yes.
Wow. Wow.
They went home and they put it into Chat GPT, and she goes, "I think I have Bell's palsy." So
Ah,
went to a
yes.
different ED, and the doctor said, "Yes, you do." With medications, steroids, etc., she felt better in 4 hours. And here's the thing: with delay in treatment for Bell's palsy, you've got a potential for a permanent facial droop
Oof.
versus correcting itself. So, yes, I fully support using AI.
Yes. Okay. I remember when it first kind of burst on the scene, I put in some I asked about menopause and it was pretty good, but it's definitely learning. Like it's getting way better very
It
fast.
is.
Yes. So here's the thing, for the listeners, they can use it. Use it for your diagnosis. Use it to start to educate yourself on, as Dr. Julie has just said, which questions we want to ask of our specialists. I always encourage my patients when they're going to see a specialist, I'll say, write down your questions. If you've got 10 questions, your expectations are unrealistic. See if you can get it to three, maybe
Yes.
two.
Yes. Unfortunately, they're squeezed for time, and you're going to
Yes.
have to be very succinct with, and that's why I say also write down things so that you can see a trend or pattern, and
Yes.
then you can say, "This has been going on for 7 days." That's a lot more meaningful data to your provider than saying, "It's been a while." Well, what's a
Yeah.
while, right?
Yes. Yes, absolutely. I think that's really, really incredibly powerful stuff. So when it comes to, I love what you said about second opinion. It's like giving permission. Why we're afraid to ask for that. And this is what I see often too, is that, and this is true when women are trying to access hormone replacement therapy, is there, if the doctor says no, which is usually unreasonable when they're saying no. And then the patient doesn't want to, quote, make a fuss. I've heard that. So women need to get noisy. We need to get a little pissed off
Yes.
about this.
You're the one living with what's going on in your body, right? Not them. And you're right. You're exactly right. I think we need to change the culture of the expectations of the authority gradient that seems to exist in our culture of the doctors on a pedestal. And believe me, I respect the school they went to. I respect the years they've put in. But on the other hand, they don't know you or your family member like you do.
Yes. Oh my gosh, yes. So take back your power, ladies. This is what Dr. Siemers is telling us. Absolutely take back your power. It's, as I say to my patients, I might have the fancy bit of paper on the wall. That just means I'm foolish. I like to spend my money on education. But you know your body better than anyone. So even if I'm over here saying this, if you know for yourself that's not it, say so. Because there's always alternatives. There's always other things that we could look at and say, or other practitioners that we can bring in. But I think, in a lot of ways, I think women have an advantage here because we tend to be more, obviously, there's going to be exceptions to this, more collaborative, anyways. You know what I'm saying?
Yeah, I do too. And I think we're more likely to talk about it too.
Yeah, I like that. The first time I heard about, as I said to you, I'm in Canada, and when I was younger, we didn't have nurse practitioners here in Canada. And it
Mhm.
wasn't until I went to professional school in the States that I actually met a nurse practitioner. And I said to her, I said, "What is a nurse practitioner?" And she said, "Well, basically, we can do all the things that doctors can do. There's a few exceptions with medications that are controlled a little differently for us than for doctors. But she said, basically, we sit knee to knee with the patient and say, let's figure this out together, where the doctor says, here's the answer, go do what I'm telling you to do." And I years later, like that was 25 years ago, and I still remember that. And I just think that nurses have such an incredibly special place in medicine. And having been at the bedside of this family member that I was just talking about, the nursing care was exceptional across the board for weeks, for weeks. And so nurses are some of my favorite people. And I think that in a way, they can be a really, when we're talking about hospital stays, sometimes the nurses are not sometimes the nurses are so much more approachable. If the doctor kind of frightens you, talk to the nurse.
Yes. Yes, that's a really, really good point.
Hey there, Not Your Mother's Menopause listeners. Let's talk about something we rarely think about, but totally should: nutrient absorption. You might be eating all the right foods, popping the right supplements, and still, your body might not be getting what it needs. Super frustrating, right? You see, the nutrients that fuel your energy, mood, memory, and even your sleep are some of the hardest to absorb. And let's face it, midlife doesn't exactly make it easier. Throw in stress, gut issues, meds, processed foods, and you're left wondering why you're still feeling blah. All is not lost. Have you ever heard of liposome encapsulation? It's like a nutrient delivery service with VIP access. Liposomes are tiny protective bubbles that safely shuttle nutrients straight to your cells, bypassing all of those absorption roadblocks. And when it comes to midlife must haves, Live On Labs has you covered with their lipospheric supplements. Think ultra absorbable vitamin C, B complex plus, and their star player, lipospheric magnesium. That last one, it's basically brain fuel. Magnesium L-threonate is the only form proven to raise brain magnesium levels, helping with memory, focus, and relaxation. It means it crosses the blood-brain barrier. That's pretty cool. Plus, they added choline to support neurotransmitter production. Oh, and MTHFR, you say? You know who you are. The B Complex Plus has methylated folate, so you get exactly what your body needs. And here's the best part: Live On Labs is offering Not Your Mother's Menopause listeners an exclusive deal. Head over to liveonlabs.com/lovely. That's livonlabs.com/lovely and snag the midlife bundle. You'll get vitamin C, B Complex Plus, and magnesium for $56 off. Your cells deserve VIP treatment. Give them the nutrients they actually absorb and get ready to feel like yourself again.
Nurse practitioners, I would just add this bit of caution, at least for the US. I don't know about Canada training. So I've taught in a bachelor's program for 15 years or led the schools. Those bachelor students can go right into a master's program and go right into nurse practitioner school. Many schools will take these students for the education, and they haven't had any clinical training or clinical experience, I guess I should say. So just be cautious if you're getting some information from a nurse practitioner in the US that sounds kind of like, I don't know if that's quite right. Or again, get a second opinion when you've got some hesitations on. But again, they're filling a gap. We don't have enough physicians, and so the physician assistant and the nurse practitioner both being mid-level practitioners is a definite additive to our healthcare team.
Yes, absolutely. So you've been a nurse from your TED Talk. You've been a nurse for 45 years.
It's crazy, isn't it?
Oh my God. Did you start when you were 5?
Right out of high school. Yep.
Right. God. Do you miss it? Do you miss being clinical?
No, because I feel like I'm still so involved in doing the research and talking to students and educating other nurses in the hospitals that I still have my finger on the pulse. And there's some things that just don't change. The physiology and pathophysiology and, how the body responds to things and how it works doesn't change. So it's learning the new technology, which is awesome, but really it still boils down to the individual patient.
Yeah, absolutely. I'm sure you're like me. It was a bit of a rocky transition to go to electronic health records, wasn't it? For
Yes.
those of us that were doing paper files.
Yes.
I'm still stinging from that one.
Challenge.
It is a challenge. It is a challenge. So tell me, if you yourself, heaven forbid, find yourself in the hospital, what are the first 3 things that you're going to do?
Well, hopefully I'm with it enough to ask questions. And I think that is the most powerful tool that patients and the families can use is asking questions. We can't assume. And so if the nurse has given me a pill, I'm going to say, what is this for? And if I don't know, what are we expecting the action to be? What are the side effects I need to watch for? And really saying, oh, that's a pill for my heart. Well, what do you mean by for my heart? Because there's many different actions or mechanisms of different medications for the heart. And if I'll give you an example, I did helped with a legal case several years ago where a patient was told, this is your heart pill. When she took a fall and hit her head and broke her arm on some stairs, she went to the little quick care. It was a little bit of a rural area. And when the nurse was taking her, you know, intake, history and physical, and she said, yes, I take a heart pill, they didn't realize it was a blood thinner. And so when she ends up with this huge black eye very quickly after the fall, and they set her arm, they didn't send her for a CAT scan, and she's heading home with her daughter. They stop for lunch. The patient goes into the bathroom and never comes out.
Oh my God.
She
Yeah.
ended up with this huge bleed in her head because her heart pill was actually a blood thinner. So, again, I believe if she would have said, or they would have looked to see what that medication was, then they probably they should have sent her for a CAT scan because that's, cerebral bleeding is Can cause death, and unfortunately it did.
Okay, so ask questions. Number one. Number
Yes.
two. Yes.
The other thing I would say is make sure they wash their hands. I know that sounds so basic and so simple, but we still have an incredible problem of healthcare acquired or healthcare associated infections, which for your listeners is you go to the hospital, you don't have an infection, and a day or two or three later, now you've got an infection, whether it's MRSA or C. diff or one of those transferable, communicable bacterias or viruses. And washing the hands, we're all taught in nursing school, medical school, phlebotomy school. It's the single most simple and easiest and most effective way of cutting down transmission of infections. So don't let somebody touch you unless, they've washed their hands. They may get a little uppity and say, well, I just did in the other room. Well, that's okay. I'm glad you did, but you please do it again. People have even trouble saying that because they don't want to ruffle feathers. But you know what? I look at it this way. If you don't speak up because you're scared, think about the consequences if you don't speak up.
Yes.
And
Wow.
they're not fun consequences or good ones.
No. Hopefully, the nurse you don't ruffle the feathers on is the one in charge of placing your Foley catheter. Those are two great tips. You got anything else you'd like to share with the listeners? You in the hospital.
Yeah, I would again just ask for what did my chest x-ray show this morning? What did my dad's blood gases show this morning if he's on the ventilator or got a history of congestive heart failure or is in for pneumonia? And again, take notes. I think we talked about this before, but when we talk about the Joint Commission referring year after year to communication breakdowns as responsible for 70% of patient harm events, there is a lot lost in translation. If your loved one's in the hospital for 3 days, you may have six different nurses. You may even have several different doctors, and they each may lose a bit of data or information that's really pertinent to your care or your family member's care. So just take notes and just say, oh, well, I thought the other doctor said we were going to try this treatment or this medication. Oh, because they don't look at each other's notes many times. They should, but
Mhm.
there's a continuity of care that can be lost by, again, lack of communication. That's what I would say.
So just again, be noisy. You have permission to be noisy, to ask questions, to be a pain in the ass, to make a fuss, to do all the things that we as good girls in our society were taught not to do, which is, just to be quiet and not stir the pot. Well, this has been incredibly helpful information for my community. Dr. Julie Siemers, thank you for coming on the show. Where can people find out more about you?
My website is drjuliesiemers.com. You can find my book on Amazon, all of my socials. I do a lot of patient and family education on the socials, TikTok and social, Instagram and Facebook, where I just give a couple minutes of tips. If you're going in the hospital or if you've got a family member, what are normal vital signs? What do they mean? Same thing in the book. There's different chapters covering different parts of the hospitalization. My whole mission and goal is to help people become empowered and educated to stay safe.
Thank you for that. I tell you, it's such an important topic. Such an important topic. And you might not think it's important until you find yourself in that situation and you go, I really should have listened to that episode of Not Your Mother's Menopause podcast. Or
Well,
been, yes, I've been on Dr. Julie's Instagram or TikTok.
that's a really good point because when you're in the hospital or at a time of crisis, getting a diagnosis or had an accident, that's not the time to learn. That is a time where your high anxiety and your stress levels, you're not going to be able to implement. But if you had the discussion with your family members about, hey, we're going to have surgery, or, let's take turns being with mom at the hospital. What are we going to ask? What do we need to know? And really informing yourself and being proactive is really your best defense, you
Yes,
know?
absolutely. This makes me think of when my mother, who has passed now, but when she was getting ready to be moved into assisted living, there was four of us that were rotating through care for her at her home until she was moved. And my sister-in-law made a spreadsheet. I'm telling you, that spreadsheet was so helpful.
We laugh, but it's true.
Oh, so true. I think about it now. That was 5 years ago. I still think about that damn spreadsheet. It was so, that was the day the nurse was coming in. I was on nights. My brother was, all of that. It does make a difference. And you're right. When you don't wait for the diagnosis to be educated about things, and because you're not absorbing the information at that point
Yeah.
anyways, right? And
You brought up a really good point in medications and schedules.
mhm.
Medication errors are responsible for so much patient harm. So either the wrong medication, the wrong patient, you would think this happens, the wrong dose, the wrong route. But there's so many cases that occur. Medication didn't get documented. And so the nurse coming in the next shift, and that's again where you can advocate and say, what are you giving my mom? Oh, well, this is her blood thinner. Well, she already had that. Oh, well, the chart says she didn't. And you
Mhm.
can prevent the double dosing. And so there's all sorts of ways that you can be curious, and that way you're not alienating the healthcare team. But one tip I'll share with your listeners real quick too is the
Please.
three P's:
Please.
be present, be polite, and be persistent. So if you think something's wrong or you're really scared or nervous, of course, the cuss words we talked about in the TEDx talk, but be persistent in that you can advocate to the charge nurse, the house supervisor, even the hospital administrator that's on call if it's nights or weekends. So you may not get the action you want when you're really concerned that your mother isn't acting like her normal self. Um, but yeah, this is again about being informed and empowered.
Oh, yes. Present, polite, and persistent. I know the words I say to my patients when they're talking to their doctors about HRT is I say, "Am I a candidate for?" And that leaves it again, curiosity. You're asking a question, you're being polite, and you give the power back to the doctor who's prescribing it anyways. And that goes a long way, doesn't it? And they're,
Does.
yeah, it
It
really
really
does.
does. And as I said earlier, it's we've got to build that bridge, even if it's brick by brick. I know we don't build bridges with bricks, but you know what I mean, step
I
by
do.
step.
Yep.
And we have to change the culture and the expectation. And the more that we ask instead of sit silently, the more the expectation is then going to be there. My patients are really interested. My patients want to take autonomy for their healthcare. And that really is where I think healthcare providers would like us to be, right?
I would like to think so. I would absolutely like to think so. It's when we booked this conversation, I thought, I can't wait to get the answers from you. And I have some answers. And I have even more concerns after talking to you, hearing what the risks are. And not,
Yeah,
for myself, I am noisy. I'm going to be the one that's asking the questions. Nobody has to tell me to do that. But there are a lot of people, a lot of women, a lot of cultures that just the doctor is the end all be all. A lot of age groups. Certainly,
yeah.
my parents, my grandparents were like that. What the doctor says goes. You do not question it. It's inappropriate. It's rude. It's all of those things. And you're just saying, not if you want to be safe, sister. You got to pursue all of the things.
You do. I'll give you another example is
Please.
if you're going in for surgery, the wrong site surgeries happen still 20 to 40 times a week across the
Wow.
US. And that just tells me that the surgical safety checklists
Yes.
still have human error. And so, one of the things that I would do if my mom were going in for, a mastectomy is make sure that the markings are there and it's the right breast that's going to be marked
Yes.
to say, this one is correct. There was a man 2 months ago that had his left knee replaced in surgery instead of the right knee. And so, unfortunately, and again, it's just knowing that these things happen that you can actually speak up and say, okay, Dr. Jones, how are you going to ensure us, this family who loves our dad, that the right kidney is going to be removed, not the left one or whatever the situation is? that's scary in itself, right?
It
And
is.
here's what I'll have to say. I am hopeful. I do think that we can turn this around, this patient safety crisis that we're in. But again, it's going to take all of our voices. But I think we can do it. I think doctors and nurses never mean to harm anyone.
Mm-mm. Mm-mm.
But knowing it's a systems error, yes, it's a human that may make a mistake, but we need to do more on the healthcare team of investigating how did that nurse pull a paralytic drug out of the dispensing cabinet instead of a sedative? How did that happen with the bad outcome that the patient died? We have
Mm.
to go back instead of pointing the finger of blame, because it does feel good to say she did it, put her in jail, but it never solves the problem, right?
Mm-mm. 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 No, absolutely not. Systems errors. Fascinating. Fascinating. Thank you again for bringing your expertise to the show. And I always have a final question that I ask all my guests, just off the cuff. Knowing what you know
Hmm.
now, what would you tell your younger self?
I would say start this journey earlier instead of waiting as long as I did. And it just kind of unfolded, but absolutely have the confidence and courage because this needs to be done. This needs to be communicated. So I'm grateful for all my experience and education I've had that led up to this time, but I also wish it was 20 or 30 years ago.
That's fair. I think I think you're doing way more than probably it feels like you are. Just opening the
Thank you.
conversation is so, so important. Dr.
Thank
Julie
you.
Siemers, thank you for joining me on the show.
Thank you. Appreciate it.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.